So you're going to be talking about acupuncture and the benefits that that will have for our pets, in particular dogs. I know you've got a lot of experience with that, and you were one of the pioneers that started acupuncture early on. So that's quite amazing.
Yeah, I was one of the first 40, 50 veterinarians in North
Yeah,
America to ever do acupuncture. And it was right when when China opened its doors to the West. And a couple of my first teachers were the ones that were brought to China to train in it and trained in it in North America. And then I started studying with them and then brought it to the Animal Medical Center in New York City, which is the largest animal hospital in the world at the time. And they were quite skeptical, but then they started hearing and seeing about the success I was having with it. And they said, okay, why don't you come down to Animal Medical Center and give us a talk? And I was just this idealistic, animal-loving veterinarian who was excited that you could help animals that couldn't be helped any other way. And so after my presentation, they said, well, let's do an experiment and we'll start where we'll have you see patients here after we've done everything we can in Western medicine at the absolute best animal hospital in the world. And when we recommend euthanasia, we'll refer them to you and see if you can help.
yeah.
And that's how it all got started.
Yeah, and you've done amazing work, and you've really encouraged people to go into integrative medicine and do more for our pets. So thank you so much for that. Um, Perfect. All right, I'm going to leave the screen to you, and I'm just going to bring the presentation up. So give me 1 second.
So, okay, if people are listening
Yeah,
while you're
yeah.
trying that, I'll keep on speaking. So this is what I'm sharing with you is from over 40 years, over 35 years of pioneering veterinary acupuncture. And I'm so excited because I got into it because, again, I was an idealistic veterinarian and animal lover who's just wanting to help animals that didn't respond to Western medicine and surgery. And so it first got me into acupuncture because I also have a master's degree in neurophysiology and animal behavior. And when I first started training in veterinary acupuncture, it was I said, my gosh, this is practical applied neurophysiology and it needs to be brought in because there's so many animals that can be helped. And at that time, most of the veterinarians and most of everything that was introducing acupuncture was talking based on traditional Chinese medicine, the acronym being TCM. Here's my slideshow that Sandra has on. So what I realized was for all of this, for acupuncture to being the door to opening to more of integrative medicine, back then it was called alternative medicine, you had to go with the approaches that had the most scientific basis. And you had to explain it based on Western science, going beyond yin and yang, as this book cover shows, how acupuncture really works. And, and it isn't that I don't love and have tremendous respect for traditional Chinese medical theory. I do, and it's been educating and training healers for thousands of years. But what I realized was in order for it to be accepted by conventional veterinary medicine, we need to talk about it as far as neuroscience goes. And that's what got me so accepted is I was the first veterinarian who also had a master's degree in neurophysiology and animal behavior to start explaining it to veterinarians based on neurophysiology. So Sandra, if you can go to the next slide, and I'll just go next on that to you each time. Okay, so acupuncture can be viewed from a Western scientific perspective based on neurophysiology and neuroanatomy. And that's what I realized was the only way it was going to get accepted. Or it can be based on TCM, or an integrative approach combining Western medical, TCM, Japanese, European, and other perspectives. And that's kind of the way I did it. I had respect for all the different approaches, but in order to get it accepted, I focused on the Western medical. So the classic definition of acupuncture is it's the insertion of fine needles into specific predetermined locations on the body to achieve a therapeutic or homeostatic effect. So what you're doing is it's a stimulation of specific points on the body, causing different stimulation at the local, segmental, and central acting throughout the entire nervous system. And essentially, it stimulates the sensory afferent nerves, the nerves in our skin, which send impulses through the spinal cord up to the brain and cause the release of various neurotransmitters and neural hormones, which then have effects throughout the entire body. So the essential effects, because my goal right now with all of you listening is for you to have an understanding and an appreciation of how acupuncture works, the different ways it can be used, the different techniques, and then go into some cases so you can have an appreciation of the different applications. And then I'm actually going to teach you one point that you can use in emergencies to help save your animal if you need to. And then you can go to my website, drschoen.com, for more information and my books. I've written numerous books on acupuncture, both for the public and the first textbooks for veterinarians. But essentially, the effects of acupuncture are it restores blood, nutrient, and in TCM, it's called vital airflow. So in simple English, it increases the microcirculation to all areas of the body. By increasing the microcirculation, it increases the blood supply, and with that, the nutrition to those areas and the oxygen to those areas, and that helps accelerate healing. It helps restore visceral and immune function. By visceral, what I mean, this is more for veterinarians, the slideshow, but essentially what it does, it helps increase all the nutrition, blood supply to the internal organs. So that's why it can be beneficial in helping treat liver disease, kidney disease, respiratory disease, the heart, all the internal organs. By increasing the circulation to them, it helps accelerate the healing of those organs. And then it promotes physiologic and autonomic balance, what's called homeostasis. What it does is it can be used to treat, but also to bring the body back into balance. So that's why when some skeptics say, oh, you say it can be used for anything. Well, in a way that's true, because the whole goal and effect of acupuncture is helping to bring the body back into balance. The other main effect is it helps relieve pain. Back when I first started, there were only a few theories on this, but now we know, and it's well documented, that it does help relieve pain and inflammation, and it helps promote tissue healing, again, by increasing circulation. This is the first photomicrograph. These are all in my textbooks, Veterinary Acupuncture, Ancient Art to Modern Medicine. This is the first photomicrograph of an actual acupuncture point. And what it does, it shows this microtubule of connective tissue, of fascia, piercing through the rest of the connective tissue on the back of a cow. But it's the same whether it's a human, a dog, a cat, whatever. This is but this was documented at University of Vienna Veterinary School. So on this slide, it shows a cross section of that microtubule. So in it, it shows that there's an artery, a vein, a nerve, and then they're all surrounded by a sheath of connective tissue. And that's really important for you to understand, okay? Because the original theories, well, go to the next slide and I'll show you. So these microtubules perforate, go through the fascia and go up and innervate at the top where it says the epidermis. It innervates the skin. And this is where you insert a needle or do different acupuncture techniques to stimulate those nerve endings in the skin that then goes through the microtubules and through the nervous system to the spinal cord, up to the brain, and then has its effects all over the body. Next slide, please. There we go. So acupuncture points are usually found in depressions between muscles and bones, or in muscles. So you can actually find them on your dog. And probably the easiest place to find them is if you find the back of your dog at the intervertebral spaces between the vertebrae. And then you just go about a finger's width to the side of each, and you'll feel a depression, a long ridge of depression in the muscles between two muscle bands. And then if you go from the intervertebral space, the depression between the tops of the vertebrae, into that valley in between the muscles, you'll feel little depressions about the size of your finger, depending on the size of your dog. In a horse, it's about the size of a quarter. In a Great Dane, you can almost put your whole fingertip in, and in a Chihuahua, you might fit your fingernail in. But you fall into these little depressions. Those are the acupuncture points, and those where the nerves come in, and that's where you have the highest concentration of nerve endings, and that's why they're acupuncture points. So these were all the different theories for decades on how acupuncture works, through local inflammatory and muscular effects, through the spinal cord, through the release of different hormones, through balancing the nervous system, the sympathetic and parasympathetic nervous system, the bioelectrical conductivity throughout the nerves and throughout the fascia and connective tissue. And the way I've been teaching it for over 20 years now, where I've been a professor at 2 different veterinary schools and lecture on this throughout the world, is what's called the liquid crystalline collagen continuum theory of acupuncture. And the reason I teach it based on this is, number one, it's the most scientific, and number two, it combines all these other theories into one theory that makes sense. Remember it as the liquid crystalline collagen continuum. And the reason it says collagen is because what we are, we're actually this liquid crystal, just like a computer screen is a liquid crystal. And our liquid crystal is a bioelectrical communication system that connects the skin to the brain throughout and the entire body through the collagen, through the connective tissue, and that's the liquid crystalline continuum. Okay, and it's composed of 2 things: structured water and collagen. And those 2 are the best conductors of electricity. So if you can understand that water and collagen are the 2 best conductors of electricity, and they wrap around all the nerves, all the blood vessels, all the veins, all the lymphatics from the skin to the brain throughout the entire body, that is this incredible bioelectrical communication system that connects the entire body. And that's what acupuncture works through. And when they talk about acupuncture meridians or pathways, and skeptics are saying, well, where are they? They're all through this collagen. Okay, so it enables all parts of the body to intercommunicate so quickly and functioning as one whole being very quickly. So in summary, I know I'm giving you a lot of information. If you want more, you can go to my website. I have papers on this that you can read for free, and I have other videos and things on it. Or if you have other questions, you can email me at my website at schoenoffice@gmail.com. But so the bottom line is the liquid crystal collagen, the LCC theory, is the first all-inclusive explanation of how acupuncture meridians, points, and how they all connect and communicate. So it's essentially a normal regulatory approach to rebalancing the body. So if you have hyperthyroidism or hypothyroidism, if you have underacting liver disease or kidney disease, the acupuncture going through this bioelectrical communication system helps bring it back into balance. That's it in a nutshell. So I joke, here's everything you need to memorize to get credit for this lecture, but we'll continue from here. And hopefully you're realizing by now that acupuncture does much more than just relieve the pain from the needle inserted before it. Okay, next slide, please. So there are many different techniques to stimulate the acupuncture points. And many of you may have brought your dog to a veterinarian and have had acupuncture done or not. But just to introduce you, so the different techniques that I've used for over 35 years, and each one of them works. Each one of them has its indications and maybe its limitations, okay? So the most common ones are, one, the traditional acupuncture needles that you see everywhere. And that's how I got started, and that's still what I use a large part of the time. Then there's electroacupuncture, where you hook up electrical instruments to the needles or directly to the skin without needles. And then there's the technique called aquapuncture, where you're injecting various solutions into the acupuncture points. You can just inject saline, or I've injected saline with B12, as well as with different herbal homeopathic remedies. Then there's laser acupuncture. And the nice thing about that is you can use, and that's what the picture to the right on the slide is, you can actually use a laser, and these are class 1 lasers, what I'm showing you. They're from Multi-Radiance Medical. This is called the Activet, and you can go to my website for more information on those. And essentially what that is, it's nice because here it is I'm using it on a dog that has severe arthritis in its elbows and wasn't crazy about needles. So by using the laser right on it, you're sending in laser light, okay, which increases microcirculation and stimulates ATP in the cells, and not only relieves pain, it actually helps regenerate the cells. And what's nice, again, is for animals that are hesitant to have needles in them, this is a very practical way. Another nice thing about this is many veterinarians who have the Activet laser, they have what's called the My Pet Laser Rental Program, which, again, you can find more information on my website, where you can actually rent one of these lasers from your veterinarian and use it at home while in between treatments. And especially now with COVID and everything, where it's hard to get appointments at veterinarians except for emergencies or something, they can rent you out one of these lasers. And when you're sitting at home watching Zoom or watching all the different TV because we're stuck at home, you can actually be doing acupuncture on your dog to treat various symptoms, relieve arthritis in old dogs, help them move better, help them walk better. There's so many different indications, which we'll go through quickly here. And anyway, the nice thing about this laser and the Activet Multi-Radiance My Pet Laser Rental Program is during these times when we're being locked in and we're caught at home, you can actually be doing this at home. And again, if you want more information on that, you can go to my website or just email me and I can send you the links on finding a veterinarian in your area that has these. Okay, then there's a more ancient technique called moxibustion, where you're heating herbs on the acupuncture points, which is very nice, except the challenge is moxa smells very much like an herb that is still illegal in many places, called marijuana. And so it smells very similar. I used to get comments when I was using it in the veterinary clinic and people were laughing. But anyway, it has its indications as well. And then there's acupressure, where you can go to my website and there are links. You can actually learn how to do acupressure at home on your animal. And I'll teach you one point later on here that you can use in emergencies. But acupressure at home, you can do this when watching TV, this and that, and it increases the bond between you and your dog. And then there's a technique I used called gold implants, where if it was hard for you to get into the clinic all the time or you live far away, I would implant 24-karat gold beads into the acupuncture points right underneath the skin in the muscle, and that would cause a bioelectrical current through those areas, where it would actually stimulate the points permanently so you wouldn't have to continuously come in. And so this is a quick explanation of the various different techniques. Let's go into indications now, Sandra, with the next slide. So the indications for acupuncture in small animals, by and large, the most commonly used ones are for musculoskeletal conditions, then neurologic conditions, then gastrointestinal, dermatologic, and then there's immune-mediated, and what we can go next slide. And there's many other indications: reproductive, neurologic, just internal medicine, critical care, all sorts, which are beyond the scope of this chat, this lecture and presentation. But I'll give you the most common ones so you can have an appreciation. For musculoskeletal conditions, the most commonly used ones where it works the best, and where these are the very first cases I would be seeing, because these are the ones that were recommended for euthanasia, because back 35 years ago, all you had was steroids, non-steroidal anti-inflammatories, and surgery. And if those didn't work, the dog was euthanized. And that's why I was able to help so many. So hip dysplasia, chronic degenerative joint disease, commonly called arthritis, intervertebral disc disease, eosinophilic myositis, soft tissue injuries. We do a lot of agility dogs, okay, because they're always injuring themselves. And acupuncture is fantastic for agility dogs. Once agility became popular, number one, lots of agility groups would just bring all their animals in for acupuncture, as not just for treatment, but for prevention, to keep them in peak performance. So let's go through just a couple of examples so you can see how it actually works. This was a dear old dog, a 12-year-old male altered German Shepherd that had been treated for heartworm, which, where I was practicing at the time, heartworm was epidemic at the time. And then the dog collapsed and had acute posterior paralysis. It just collapsed in its hind legs for 4 weeks. It was completely paralyzed, and their regular veterinarian recommended euthanasia. And because the steroids and non-steroidals didn't work, and they couldn't do any anesthesia because it had serious lung damage and heart damage from the heartworm, so it was a major anesthetic risk for surgery. You can kind of see in the back around its hip, there are a bunch of acupuncture needles. And that's what we were doing. He came in for 4 treatments on a stretcher, and he would lie on the table. We put the acupuncture needles in. Most of the dogs just fall asleep. As soon as you put in a few needles, they relax and fall asleep. Every once in a while, maybe 2-3%, they've had bad experiences with needles, and so they don't like needles, and that's when I use the laser or acupuncture or eventually maybe gold beads or some of the other techniques. But 95-98% of dogs, once they get used to it, especially the first time, they may be a little bit anxious, but within minutes they start relaxing. So in this slide, you can see the x-rays in this dog. The hips are so bad. I don't have my pointer or anything right now, but you can see normally the hip is a ball and socket joint. And here, the ball of the femur is not even fitting in. Okay, next slide, please. In addition to that, this dog had severe arthritis in its back. Next slide, please. So in cases like this, what you have multiple areas. You have the hips, you have the back, and most dogs have chronic hip dysplasia, chronic arthritis in the hips, also have back issues, just like humans. And anyway, so after 4 treatments of dog coming in on a stretcher, after that, on the 5th treatment, the dog runs in wagging its tail. The client is so excited and says, "Take a look, look what happened." That's typically what happens. And this dog ended up living to be over 15 years of age, and finally was euthanized at 15, which is amazing for a German Shepherd. And at that time, because it was just getting too weak, it couldn't walk anymore. But it had 3 years of great quality life. Now, some of you may be asking, gee, how often does it have to be done? Initially, I asked for a commitment of twice a week, but then finally I realized even once a week was okay. But if you can, ideally twice a week for the first 2-3 weeks, and then you taper off to once a week, and then to every other week, then to once a month, and you start seeing how long it lasts for that particular dog, because it's not a cure, but it's a great treatment. This particular dog, and most dogs after the initial 8 treatments, we're able to taper them off to once a month, and once every 2 months, once every 3 months. Some of them would come in just 3 or 4 times a year for what we call acupuncture tune-ups. And funny enough, I had some clients who said, you know, coming in once every 3 months is great. I really appreciate it, but would it hurt if I just came in once a month or once every 6 weeks to do it preventatively? And I said, no. And those clients said, you know something, the dog, they love coming in because they, instead of associating the veterinarian with being castrated or a surgery or something, they're coming in and they're getting an endorphin release and they feel good after each treatment. So the dogs would come in, run into the exam room, lie down, lick my face, but even though it's not supposed to be done, but they were just so happy. And then they would fall asleep for the treatment and run out. So these dogs loved coming for acupuncture. 99% of them loved coming in once they started feeling better, because I always joke and I say, does the name Pavlov ring a bell? They associate coming to the veterinarian with feeling good instead of feeling bad. And so anyway, that's what this dog did, and that's what so many of the other dogs did. So the effects of the acupuncture for arthritis, one, it causes a release of endorphins. So again, the dog just feels better. 2, it causes a release of ACTH and cortisol, so it has anti-inflammatory effects, so it relieves the inflammation associated with arthritis. 3, it decreases the muscle spasms around the arthritis. And 4, it increases the local microcirculation to the area, to the muscles and the bones, increasing nutrition and oxygen to the area, helping the muscles stay stronger, increasing mobility. And I know, you know, at this point, after pioneering all of this, I do acupuncture on myself regularly and have it done. And I have the Activate laser that I use regularly for my own arthritis in my hips from working on too many horses for too many years. Okay, next slide, please. So I know firsthand how great it is and how much I love it. So then next big indication of neurologic disorders. And the common neurologic disorders where acupuncture can be of benefit, it doesn't work all the time, but where it can be of benefit are in epilepsy, in cerebrovascular accidents, geriatric vestibular syndrome, geriatric deafness, as well as peripheral neuropathies. Now, I'll just preface this. There's so much, each one of these, I've been teaching acupuncture at veterinary schools around the world for over 35 years, and just going over arthritis is a 2-hour lecture. Going over neurologic disorders is a 2 to 3 hour lecture. All of these. So I'm just trying to give you a little snapshot so you can have an appreciation of where it might be appropriate and might be a benefit to your dogs. Okay, so for epilepsy, most of the time I use it when Western medications are not working. But sometimes clients would say, gee, before I start them on the stronger medications, if my dog isn't too serious, can we try acupuncture first? And if I feel it's appropriate, we may do that sometimes, okay? And, you know, one of the things that I first started realizing, because I was pioneering this when it was never being done, on animals, I was extrapolating from the acupuncture texts on humans from China and applying it to the animals, because it didn't exist back then for animals. You know, like when I was teaching one time at Beijing Vet School, years later, they came to me and they laughed and they said, we made the acupuncture maps on dogs and cats for you Westerners. We were just eating dogs back then. They never had the maps for dogs. So again, as a pioneer, we were trying to figure all this out. And one time when I was working in one of the first veterinary emergency referral centers, one night in it, I had like 12 dogs that were in status epilepticus. It was during a full moon and a blizzard, and everything. And I was using all the conventional Western medicine, and it was helping to some degree, but many dogs would break through with status epilepticus, continuous seizures, despite all the medications. So at that point, I said, well, I have nothing to lose. I started adding acupuncture to all these 12 cases, and I was so shocked and pleased. Each one of them, it was able to break those epileptic seizures that were ongoing despite conventional medicine. So they're great applications in epilepsy. Cerebrovascular disorders, commonly called strokes. I've used it to help recover from strokes, and as skeptics would say, well, they might get better anyway, and same with vestibular syndrome. The cases, the patients I was seeing are ones that were not responding to Western medicine, were not getting better on their own, and then I did acupuncture. Within the first or second treatment, they started to improve. So to the skeptics, I would joke and say, here's another example of a spontaneous remission following acupuncture. Okay, but when you saw it over and over and over again, it was predictable, it was repeatable and documented. People were going, oh my gosh, and veterinarians were saying, wow, okay, I have nothing to lose, let's try it. And the same with neurogenic deafness and peripheral neuropathies. Next slide, please. Oh, this is just a map of some of the acupuncture points for epilepsy. So this particular dog was an 11-year-old male Basset that had an acute onset. All of a sudden it was paralyzed, just like that German Shepherd. And it went to the Animal Medical Center, #1 animal hospital in the world. We had 80 veterinarians there. It's an 8-story building in New York. And it was the place to be if you were a top veterinarian at the time. And I established the first department of veterinary acupuncture outside of China there at the Animal Medical Center, based on the success I was having with all these dogs and cats and others. So anyway, this dog had acute onset of posterior paralysis. It was recommended for surgery by the surgeon and neurosurgeon until they did a myelogram, this is before MRIs and CAT scans were available. This is going back to 1982. And they did a myelogram, injecting a dye into the spinal cord, and what it did, it showed that there were multiple areas of spinal cord compression. So it wasn't just one spot in the spinal cord, one intervertebral disc. There were many of them. So the surgeon said, there's no way in the world we can operate on this dog because there's so many areas where the spinal cord's compressed. In addition, it also had severe hip dysplasia. So where it had all these different issues, the neurosurgeon said, well, we'll do steroids and non-steroidal anti-inflammatories. Nothing worked at all. And the dog was having all the side effects of steroids, drinking more, urinating more, behavioral changes, all the different side effects. So the surgeon recommended euthanasia. And then he said, oh, by the way, we do have someone here doing some acupuncture. And this surgeon was quite skeptical. He said, I have no idea if it works or not, but if you want to try something before euthanasia, we can. And that's the way I was getting my first cases. And some of them I turned down because I didn't think we could help them. But the ones that I did think we could help, when we published on it, 80% of the dogs that I felt we had a chance of helping, that all had been recommended for euthanasia, 80% of them improved and were able to live a good quality life. That was the first retrospective study showing the benefits of acupuncture on dogs. So this is just showing the myelogram, and I don't expect you to all see it, but it shows multiple areas of spinal cord compression. Next slide. As well as the severe arthritis and hip dysplasia on this x-ray. So here's the dog getting electroacupuncture. You can see the little electrical cords attached to the needles and over the back and over the hips, and you can see how relaxed the dog is. And that's the way most of them do. They lie down. Once they're used to it, they just lie down and they relax. And here you can see a close-up of these are the acupuncture needles going into those acupuncture points that I mentioned earlier to you on each side of the midline, in that depression about a finger's width from the midline, where you can do this on your dog. Just make sure they don't mind it, because sometimes if you're doing it on painful areas, they can turn around to bite you. So be careful and take all your precautions. This is just education. And anyway, you can see where those needles are in the depressions to the side of the midline, and then how the electroacupuncture cords are attached to them. And this is a dog, again, it was after 4 treatments of coming in on a stretcher, and it's standing up and wagging its tail and was able to continue walking and did great. And we tapered it off then again down to from twice a week to once a week to once every 2 weeks to once a month, then to every 2 months. We got this dog down to once every 3 to 4 months. And it lived to be over 15 years of age again. And the client said, you know, as I got older, would you mind if we just came in once a month? The dog likes it. The dog loves being here. And can we do it? And I said, oh, sure. And so that's what happens lots of times. The clients feel better actually just coming in once a month. But you can stretch it much, much longer. And you may turn some of them into rocket ships where they feel great, and you know, you have to be careful because sometimes it feels so good, you want to make sure they don't overdo it. Others, you know, it helps dramatically, but they're still older dogs, and you have to manage their exercise routine, make sure they move enough to keep their muscles moving, but not too much that overdoes it. And that's part of a whole integrative approach that I evolved into, where you know, you do acupuncture, I pioneered chiropractic for animals. I was the first veterinarian to ever combine acupuncture and chiropractic together, which they work so well together on the dogs and horses and others, and combine that with nutritional supplements, herbal supplements, physical therapy, rehab, all of these. And that's what my practice evolved into and I was the first veterinarian, I coined the term holistic integrative medicine, where you integrate the best of conventional medicine along with the best of these complementary therapies, but looking at it from a holistic perspective, including nutrition and just looking at the whole picture and developing a program that fits what's best for your dog in your lifestyle, in your situation with who you are, and doing everything we can to improve their quality and the length of their lives. So that's, yeah. So then other neurologic conditions where I've used acupuncture, in comas to help to bring dogs out of comas, I've used it. Peripheral nerve paralysis, diabetic neuropathies, and other posterior paralysis syndromes, eosinophilic myositis, trigeminal nerve pain, things like that. So next are gastrointestinal problems. Acupuncture is just great. This is the 3rd most common area where we use it. And where it works is it can be beneficial for vomiting, diarrhea, megaesophagus, which is a paralyzed esophagus, chronic diarrhea. Inflammatory bowel disease has become almost epidemic in dogs and cats these days, as well as for constipation. And I use acupuncture as part of an integrative approach to inflammatory bowel disease. Again, what the goal of acupuncture is to bring the body back into balance. So the way it works on the GI tract is, if it's an overactive GI tract with diarrhea or vomiting, or an underactive one with constipation, it brings the nerve activity in the GI tract back into balance. Okay, next slide. So the National Institute of Health actually, back in 1998, when I did my textbook on complementary and alternative veterinary medicine, where I was putting together all the scientific research back then for all of complementary therapies for animals, the National Institute of Health found that way back then, documented that acupuncture for humans is beneficial for peptic ulcers, abdominal pain, liver disease, diarrhea, ulcerative colitis, irritable bowel. And that was over 23 years ago. And now we know so much more. And we know how to integrate it, again, with dietary changes and other holistic integrative approaches. Next slide, please. So it regulates gastric secretion, regulates gastric motility. If it's too active or too inactive, too slow. It regulates hormones and neuropeptide release, again, bringing the body back into balance. So that's the key, is to remember acupuncture brings the body back into balance. Dermatologic problems. Acupuncture can be beneficial for allergic dermatitis, neurodermatitis, lip granulomas. Usually I start with other approaches first, but with dietary changes, different herbal supplements for allergies, changing the environment. I do a complete environmental questionnaire as part of my intake on all these different patients. But acupuncture I use for skin problems if the things that you do at home, the things that you change are not doing enough. Next slide, please. Other indications for dogs: respiratory conditions, reproductive conditions, cardiovascular conditions, and immune-mediated disorders. Next slide. So it can be used for all of those. So let's say for immunoregulation, I've used acupuncture, gosh, when parvovirus first came out in dogs, I had such great success in using it as an adjunct to conventional medicine. And we found that it was when the white blood cell counts were low in parvovirus, the acupuncture improved, stimulated the immune system, brought the white blood cells back into balance, and helped with the vomiting, the diarrhea. It was so great. When, again, in the epidemic of parvovirus in the 80s, I was using it all the time while they were in the hospital to help in addition to conventional medicine and everything. And then in cats, feline leukemia, all the different infectious diseases, it's beneficial. And in dogs with rheumatoid arthritis and, again, allergic dermatitis, in rebalancing the immune system. Again, it regulates the immune system. Circulatory problems. Now, this is a spot where I'm going to actually teach you a point that you can use. You have to be careful with it, but that you can use in an emergency. And this is called GV26, or governing vessel 26. Neurophysiologically, it has what's called a sympathomimetic effect. It stimulates the release of endogenous epinephrine, adrenaline, right where it's needed, in the heart. So it's great for cardiac arrest in an emergency. Hey, next slide, please. And this, when I teach, I say, okay, well, here's the point. Governing vessel 26, the place, it's located right on the center of the upper lip. And it has different nerve branches from the infraorbital nerve. And it's used, most useful point for emergencies and shock therapy. Next slide, please. So this is where it is. Now, Sandra, I see on your slides it says click twice to minimize video. That's right over where the point, but hopefully everyone can see it. But essentially what you do is you draw a line down the midline of your dog's nose and another line at the ventral line of its nostrils. And right in there, there's a small depression. That's where governing vessel 26 is. Now, you can't use that on an awake dog because they might bite you because it's a very sensitive and painful point. But in a dog that has had, let's say you had a dog at home and it got hit by a car or had a cardiac arrest from an allergy or from heart failure or something like that, and it's unconscious, you can actually use your fingernail and do a little acupressure, and instead of the acupuncture needle where it's pointing there, you can just press on it with your finger and tap on it hard, and you can actually stimulate it that way. And I know a number of my clients that had used that in emergency situations and said, Dr. Schoen, thank you so much for teaching me that point. It saved my dog's life. So next slide, please. This is the first electrocardiogram ever done on a dog while it was having cardiac arrest and then had governing vessel 26 stimulated by me. And this was done at the Animal Medical Center when I was on staff there. And what they did, I had just given a 1-hour lecture to all the heads of all the departments and all the interns and residents on 1 hour just on the scientific basis and neurophysiology of this one acupuncture point. That's how much research there was on it, on GV26. Then the head of neurosurgery, who was my greatest skeptic, said to me, you know, Alan, I might almost believe that acupuncture might relieve pain in some dogs with severe arthritis, etc. But I don't want to hear you talking about bringing animals back from the dead here. And he was very sarcastic and cynical. And I said, I'm not saying that. I'm saying it has a sympathetic effect, stimulating endogenous epinephrine, blah, blah, blah. And he goes, I don't care. I don't want to hear about it. Well, I felt really hurt and small after that. And I walked down into the emergency room, the intensive care unit, where a good friend of mine and colleague was running the emergency room at that time. And he said, Alan, don't worry. He's always puts everyone down. And right at that moment, one of the interns there said, gosh, this German Shepherd, 13-year-old German Shepherd that was just operated on the day before at Animal Medical Center and had a tumor removed on its spleen, it just went into cardiac arrest. So they brought it out onto the treatment table, and 8 different veterinarians jumped on it. They intubated it. They did cardiac massage. They hooked up intravenous fluids. We're giving it intravenous and intracardiac injections of epinephrine. They were breathing for it, doing every CPR that was known. And if you look in the top left corner of the slide, you can see, I don't expect you to read EKGs, but you can see some blips. And that was the EKG. Then the next one to the right shows it all of a sudden it went to a flat wave, no activity. During that time, which lasted quite a few minutes, is when they were doing the all the CPR and even electroshock therapy. Nothing was working. One by one, the veterinarians walked away. And so I just said, gee, do you mind if I give it a try? And they rolled their eyes and they said, sure, the dog's dead, feel free. And so I asked the technician to just continue breathing for the dog, doing the, because it was being intubated, and she said, sure. So during that time, I inserted the acupuncture needle in that point, and if you look on the next row, you can see all of a sudden there's a blip in the EKG again, and then to the right, it shows the activity, all the activity in the heart. When we inserted the needle, we stimulated the point, and it revived the dog. And all the veterinarians ran back and said, oh my God, what happened? And they went and stabilized the dog, and they said, okay, we have the dog stabilized. Is there any reason that you shoved the needle in? I go, no, you have it under control. And they went, yeah. So I removed the needle, and immediately the QRS complexes, the EKG decreased in amplitude, and they yelled at me, stick that needle back in. And I inserted the needle back in, and it went back to normal. Now, unfortunately, with this dog, they found that the tumor had spread to the heart, and that's why this was an issue, and it eventually did die. But it shows documented on an EKG how inserting the needle in a dog that had, according to the regular veterinarians, died, that we were able to revive it. And I published on this, and it's published and everything. And since then, the technician who was doing the CPR, she became a veterinarian and then got into acupuncture. Since then, this technique and this acupuncture point are taught throughout the world in veterinary schools and in veterinary conferences all over the world. And one of my old professors at Cornell said, you know, I don't believe in acupuncture except for GV26. She was being a little funny and cynical, but she herself found it to save lives. So we're starting to run out of time, but I have all these different slides of GV26. The neat thing about being a veterinarian is there are many variations on the location, the acupuncture points in different animals. But I've used this point in so many different species. So next slide, please. And here it is in a cat. In a cat, it's located a little bit differently. It's right at what's called the nasolabial groove. Again, it's always on the midline, but if you go to the area in the cat, the point GV26, you can see it on the picture on the left, is right where the lips meet the nose on the midline, and that's where it is in cats. But now, after teaching this all over the world, we've used it on camels, we've used it on dolphins. Veterinarians showed me when, after learning this, they've used it on dolphins. They've used it on so many different animals. And another indication, we're running out of time here, is acupuncture for geriatrics. It's great for geriatrics that have multiple health issues. arthritis, hip dysplasia, liver disease, kidney disease. And what it does, it extends life with dignity and relieving pain and inflammation, while us as the caretakers prepare ourselves for the inevitable. But it offers you control and hope. And to give you a quick example here, there's this dog, Brandy, a 16-year-old golden retriever that began acupuncture at my practice when it was 9 years of age for arthritis and hip dysplasia and spondylosis in the back. And the clients started asking me, wow, does it really work? And then it was working and said, do you think my dog will make it till 10? And I said, well, we'll see. Just enjoy the moments with your dogs. Who knows? And at 10, she celebrated the birthday and she said, do you think Brandy will make it till 11? I said, enjoy the moments and let's keep on going. And we would see Brandy maybe once every 1 to 2 to 3 months, depending on the client and the weather and everything. And then at 12 years of age, she said, do you think it'll make it to 13? And we laughed, and it made 13. At 13, we said, do you think it'll make it to 14? And they said, keep on enjoying your moments, because that's really it. That's all we have is each moment, enjoying the quality of life with each one. Well, Brandy made it to 16 and a half years of age. And on her 16-year birthday, and she brought her in because she'd always bring her in for treatment on her birthday and said, do you think I'll make it past that? And I said, enjoy the moments. And we would just laugh. So that's just one example. Next slide, please. Okay, I'm running out of time. So anyway, you can use it as an adjunct for cancer. Next treatment, it's not a cure, but it helps with the side effects of cancer and boosting the immune system. And, okay, so conclusions, acupuncture is a valuable addition to the diagnosis and treatment of many different conditions. It should be used in conjunction with conventional Western approaches, as well as additional holistic integrative approaches to develop a comprehensive program for the prevention and treatment of our animal friends and our dogs. One of my old professors gave me this slide and he goes, this is shotgun acupuncture if you don't get the right training in it, all these porcupine needles. So make sure to go to a veterinarian that's trained in acupuncture and has been doing it for a while and that has good references, because it can be a great adjunct, but it needs to be done by people who have the appropriate training. Next slide. I think that's it. Let's see. No. So healing occurs at many, many levels. And this is just one part of the way I teach. My newer approaches include CALM, the Conscious Animal Lovers movement. Okay. So be open to various therapeutic options that offer approaches to healing both our animal companions and ourselves. And I wish you all blessings of good health, love, peace, and happiness. Go forth and heal. And thank you for listening. And I hope that this is benefit to you and your animal family. Thank you again. Bye for now.